Good afternoon, everyone. Thank you so much for joining us today. My name is Victoria Strang, and I am the Community Impact Director of the American Heart Association in Southern New England. We are thrilled that you have joined us for our community conversation in partnership with the Rhode Island Community Food Bank. I want to give special thanks this morning to our sponsor, Neighborhood Health Plan of Rhode Island, for helping us to fund this important initiative. The American Heart Association is working with researchers, medical experts, community leaders, businesses, families, and more to reduce the impact of the coronavirus. Our top priority is the health and well-being of all individuals and their families locally and across the globe. We want to keep you informed with trusted science-based information and provide our communities with support and resources available through the AHA. Today, we have several wonderful speakers from our community who we are going to hear from, including Melissa Martland-Kyle from the Food Bank, Rosemary OBrien from Neighborhood Health Plan of Rhode Island, and Dr. Karen Asprey. We are so grateful for the work of our community partner, the Rhode Island Community Food Bank, who is serving as our local host for this conversation. Here to say more about the critical work being done by the Food Bank is Melissa Martland-Kyle, Nutrition Education Manager. Good afternoon, Melissa.
There we go. Okay. So again, thank you, Victoria, and welcome everybody on behalf of the Rhode Island Community Food Bank. I'm really excited to have you all here for this really important training. And I want to just do a quick highlight and shout out to all of our agency members who are watching right now, who are doing an amazing job during these little stressful and hectic times. So I hope that you join us for more future trainings that we offer at the Food Bank right now virtually. And we hope you enjoy this one. And next slide. So again, as you know, we offer a lot of in-person classes and we love to see everyone's faces, but right now we'll be doing things via Zoom and webinar training. So we hope that you check out the Food Bank and look out for our e-blast to learn more of upcoming trainings. Next slide. And of course, we're excited to partner with the American Heart Association and the Neighborhood Health Plan of Rhode Island to bring you this training. And I hope you guys really enjoy it and get a lot from it as well, since we all want to stay healthy at home, especially during these times. And next slide. And finally, I don't want to keep you so we can get to the training, but I also wanted to let you know all about our Healthy Habits online resources and tools that we have. I know a lot of you know who have taken our classes or been through our food demonstrations and other workshops and trainings. I hope you enjoy all of our Healthy Habits resources. And right now you can find everything on our website. We have monthly new videos that we'll be posting, recipes and video recipes, which are pretty exciting as well. So a lot of new stuff, please check it out. A lot of great resources that we have. And of course, you can always don't hesitate to contact me or anybody else on the Healthy Habits team for our handouts and other recipes that you can pass out to your guests at food pantries or anyone else that'd be interested in it. But definitely check out our resources. And we also have a Facebook and Instagram page as well. So a lot of great stuff out there to keep you healthy and happy during the stressful time. So I hope you enjoy the rest of this training and all the best.
Thank you so much, Melissa. The Food Bank has done so much, especially during the pandemic, and we are grateful for the work that you and your team are doing there. Today for our webinar, we are joined by two experts, Dr. Karen Asprey from Lifespan and wellness specialist Rosemary OBrien from Neighborhood Health Plan of Rhode Island. They will begin our conversation, but we also hope to hear from you. At the end of the speakers' presentations, we invite you to submit any questions to the chat box. In addition, we are recording this webinar and we'll make it available to share after the event. So please feel free to reach out to us if you would like a copy of that recording. And finally, if you are using social media throughout this conversation, please use the hashtags you see on the screen, hashtag SNEHeart and @SNEHeart. COVID-19 has changed the way many of us engage with our health on a daily basis, from increased stress, finding new ways to exercise and eat healthy, to managing chronic conditions, we are all learning how to adjust to a new normal. With this in mind, our speakers today will discuss how to stay healthy at home during COVID-19. I'd like to begin by introducing our first speaker, Dr. Karen Asprey, cardiologist at Lifespan. Welcome, Dr. Asprey.
Thank you, Victoria. It's a pleasure to join you on this webinar, and I really to highlight all the wonderful work that the American Heart Association is doing locally in our communities. We're going to speak today about staying heart healthy at home. Sorry about that. And we're going to really be focusing on healthy eating in this 25 minute presentation, but also some other really important lifestyle behaviors, exercise and smoking cessation. So next slide. As everyone knows, it's really important to recognize that in 2010, the American Heart Association really looked at all the population data that we had and came up with Life Simple 7 as really a way to achieve ideal cardiovascular health. I'm not going to read all of these 7 physiologic factors and lifestyle factors shown at the lower end of the screen there on the green line, but essentially they really, if you achieve them, you are on the road to ideal cardiovascular health and longevity. Unfortunately, as we also know, over the past 2 decades, very few Americans are actually on this road, and the prevalence of physiologic risk factors like cholesterol and blood pressure and diabetes is suboptimal in the US, as well as are the lifestyle factors such as poor diet and lack of exercise, overweight, and the other issues, obesity that drive risk. So we kind of started off as a population that has a large burden of these risk factors, which is unfortunate, and we're trying to move the needle to improve these, but we still have a long way to go. Next slide. And then COVID hit. COVID is a virus that, as you all know by now, very transmissible and easy to catch, results in more severe illness, more likely to be hospitalized than the flu, and creates more heart and blood vessel problems, blood clots, heart attacks, etc. Risks we now know from data from the US and China and Europe that risks are much higher in those who are obese or diabetic or who smoke or have underlying heart disease. And unfortunately, as you all know, infection rates are continuing to rise exponentially in the US. But what we also know is that all of these underlying risks are really driven by lifestyle factors. So there's now more and more data that suggests that while we don't have actually, proof, we do believe that lifestyle changes may reduce the risks from COVID through healthier eating, more exercise, to reduce body weight, stopping smoking, and stress reduction. So what we're going to focus on in the remaining slides is the top 3, and really focus in on these prevalent risk factors in the US population. Next slide. So we're going to talk about diet and health first, why eat healthier, the rationale. We'll talk about effects of foods on heart health and body metabolism, the effects of healthy eating patterns in the US, and the impact of COVID-19, and then talk about some practical diet guidance. Next slide. So why improve diet? Well, we know that really data that links the diet to heart health really now spans 75 years since the 7 country studies in the 1950s. And since that time, numerous studies have now linked specific foods to heart benefits or heart risks or harms. And, for instance, we now know that in a very consistent fashion. Higher intakes of fruits, nuts, fish, vegetables, liquid vegetable oils, whole grains, beans, and yogurt are associated with heart benefits. That means a reduced likelihood of having a heart attack or stroke in the years following up the initial diet surveys. On the other hand, refined grains, starches, sugars, processed meats, and high sodium processed foods and industrial trans fats are now really consistently linked to heart risks and harms. In a few cases, like the things in the middle, cheese, eggs, poultry, milk, butter, and unprocessed natural meats like, grass-fed beef, for instance, there's sort of mixed data. But the bottom line is we have pretty consistent data that these foods drive either heart benefits or heart risks. Next. We also now know from studies that started maybe in the 1970s and forward, that these foods impact many metabolic pathways, not just cholesterol, which was our initial focus on how diet impacts heart health, but also blood pressure, blood glucose, liver fat, the function of our blood vessels, which is called endothelial function, and inflammation in particular. They also can affect the gut, and particularly the bacteria that are in the gut and breaking down these foods. And then also the function of our fat cells and how many of these are emitting inflammatory markers, as well as things like platelet activity and reactivity and the likelihood that our blood will clot. So there's a huge myriad pathways that are mediating the effects of food, good and bad effects, either way. Next slide. We now have some recent data. It's certainly this particular graphic is from a Journal of American College of Cardiology that was just published this month, showing that some combinations of foods in particular drive higher inflammation and some drive lower inflammation. And what they did is follow these individuals up over decades and found that the lower or anti-inflammatory diets actually led to lower heart disease risk. So we now know that green leafy vegetables, that seemed to be the thing that has the best signal of benefit, dark yellow vegetables, whole grains, and these polyphenolic rich beverages like tea and coffee and wine in moderation drive a lower inflammation in the body and lower heart disease risk, as the opposite is true for the red meats, processed meats, organ meats, refined carbs, and the sugary beverages. Next slide. And so this really sort of is really concordant and consistent with what we now know about healthy diet patterns. So we know these foods individually have benefits, but when you eat them all together, you now end up with a healthy diet pattern that is associated with reduced risk of heart disease. So this type of a diet pattern, the first thing is fruits and vegetables, really 7 to 9 servings a day. I was just looking at some feed from yesterday on my phone about someone talking about this and saying we really should be having like 10 servings a day in the era of COVID to keep our heart and blood vessels strong. Proteins ideally should be plant-based, beans and legumes and lentils, which are very economical, and fish are the better proteins. Carbs from whole grains as much as possible, oils in small amounts, non-fat dairy or other milks like nut milks, and low amounts of added sugar, sodium, and saturated fat. So if you look at the diets that have shown in the literature to improve heart health, they all follow this consistent diet pattern, and that would be the Mediterranean diet, a vegetarian diet, or a DASH diet. These are associated with a 20 to 30% lower risk of having a heart attack or stroke, which is in line with things like aspirin therapy or statin therapy for cholesterol lowering. Next slide. On the other hand, we now know that a Western diet, or what we call standard American or SAD diet pattern, is the opposite. These diet patterns are unhealthy and associated with increased risk of heart disease. They're high in red meat, processed meat, meaty pizzas, refined carbs, sugary beverages, and snack foods like cakes and cookies, fried foods, donuts, and fast foods. and they are high in added sugar, sodium, and saturated fat, and trans fats. So we have a lot of data now to really look at the dichotomy in our diet patterns and really link these to either lower or higher risk of cardiovascular disease. Next slide. Now, we also have some recent data. This is from 2018, the Journal of Academy of Nutrition and Dietetics. This is a little difficult to read, but we also have data that diet impacts not only risk of cardiovascular disease, but also cancer, neurocognitive diseases like dementia, and total mortality or death from all causes. So in this slide, they did a systematic review and made analysis of 68 diet reports that included over 1.6 million participants, followed up over time, and found that diets that were scored as healthy were associated with a reduction in the risk of death from all causes of 22%, cardiovascular disease 22%, cancer 16%, diabetes 18%, and neurodegenerative diseases of 15%. They were also associated with significant decreases in the risk of mortality or death from cancer in cancer survivors. So the bottom line, this is all very concordant, consistent data. And it's worth noting that we don't have to have a different diet to reduce heart disease risk as to reduce risk of cancer. If you happen to have family history of both, you should rest assured that the same diet that is healthy across the board will reduce your risks of both. Next slide. So despite 70 plus years now of diet research, the unfortunate fact is that diet quality in the US is poor, and it's probably been negatively impacted by COVID. At least we're getting the beginning sort of inklings of that. US surveys from the NHANES survey database have shown that 50% of Americans have a poor diet. Diet is now the #1 killer of Americans. That's based on a little bit of different data, but only 1.5% have what's considered an ideal diet. 40% have a fair diet. Now, lower income families have fared worse, partly because of the environmental factors and living in areas where they have lower access to fresh produce. And we're hopefully changing that around. But on the good side, we also know that nutrition knowledge, what you know about healthy eating, predicts a better diet irrespective of your education level. So theoretically, you could have a very high education level and just not know anything about healthy eating and have a poor diet, and vice versa. You could have a lower education level and know a lot about healthy eating and have a better diet. And then, as I said, studies from mostly from Europe now are starting to trickle in, showing worsened diet quality since COVID, likely due to stress eating. People are stressed, they're isolated, they feel that they need to eat comfort foods, or typically sugary foods, as well as food insecurity. You've all seen lines of people lined up to obtain food from their local food banks, and there's a certain amount of food insecurity that has really been markedly increased in the face of the pandemic. And then the isolation factor, particularly for older people who can no longer get out and go to the grocery store themselves. Okay, next slide. So how do we move the needle to improve this diet? Again, quality is poor. It's the Life Simple 7 factor with the least adherence in the population. Well, practical guidance is going to be in the next few slides here. The first and easy thing to do is use the MyPlate guide. This is the USDA we no longer have the food pyramid, so we have the MyPlate model and guide now. And essentially, it makes it easy. Half the plate should be fruits and vegetables at 3 times a day. A quarter of the plate, whole grains, again, 3 times a day, and a quarter, some type of healthy protein. Again, we recommend more plant proteins, and then a beverage, a non-fat dairy or non-dairy milk or water. So next slide. So what do we get when we do this? Well, when we make fruits and vegetables half the plate, we are getting a load of antioxidants, which are, again, is good for our blood vessels and our heart, fiber, as well as vitamins. This strategy by itself is associated with the lower levels of cholesterol, blood pressure, and inflammation in our blood, and associated with lower risk of heart attack, stroke, as well as cancer. Next slide. And then making whole grains a quarter of the plate. These provide us with fiber, especially that important soluble fiber that's really good for colon health, as well as vitamin E and B vitamins with no fat. And then these also is associated with reduced body weight, reduced blood sugar, and reduced levels of cholesterol, and lower risk of heart attack, stroke, colon cancer in particular, and believe it or not, mortality or death from all causes. Okay, next slide. And then lean proteins, the final quarter of the plate. These provide us with the amino acids so important for building our muscle, our enzymes, and our immune cells. So in the face of infection, we really want to be making sure that we're getting adequate amounts of protein. Again, if it's from beans and fish, you're going to have a lower cholesterol level, blood pressure, and inflammatory markers in your blood, and then lower risk of heart disease and cancer as well. So, you know, the best way to make sure this is happening is to eat mostly home cooked meals. There's really good data from the public health nutrition space that home cooking is associated with health benefits, while eating foods away from home, and that includes takeout, is associated with health risks, particularly more diabetes, more hypertension, more kidney disease. And so it's, you know, really important to recognize that this is the best way to ensure that you're eating healthy, is to make your own home cooked meals. If you need guidance, you can take virtual classes or use online videos, apps, and recipes. Certainly there's wonderful things on the American Heart Association Healthy Living portal on heart.org. And we really recommend that you avail yourself of these great recipes. Next slide. Now, we know all this, but unfortunately, many things drive our food choices and behaviors, and they are barriers that can be difficult to overcome. For many people, particularly those who have lost their jobs during the pandemic, money and finances are a huge barrier to healthy eating. Plant proteins are expensive, fresh fruits and vegetables as well. SNAP and WIC programs have their restrictions, and fast food, unfortunately, for many is always the cheapest alternative. However, there are solutions, and we really recommend that folks be, you know, counseled, and yourselves follow these rules, is to just eat more beans and rice. They're very economical. Use the frozen veggies and the frozen fruits as well, and frozen grains. Bake whole wheat bread, buy in bulk, use bonus box. And when you do the math, actually, it's pretty cheap, and I would say in terms of the health benefits, much cheaper and to eat in this fashion. Next. Time is also a major barrier. If you or you know all this, but you have no time, you don't have to go to fast food places or your takeout. Shopping and cooking takes time, and eating out and takeout are faster. But on the other hand, you can use the frozen fruits and vegetables, frozen brown rice. I use these every day. Low sodium canned beans, always have those in the pantry, as well as tuna and tomatoes from a can. And you can buy the vegetables washed and prep. If you know they're a little more expensive, they do save time. And plan your meals. Cook all at once one day on the weekend, and then cook in batches, and you can then just heat foods up when you get home. Next. Now, cultural dishes are another thing that can make you know, we're all driven to eat the foods that we grew up with and foods of our culture. But in many cultures, recipes and foods are higher in unhealthy fats, whether it's, you know, butter or ghee or other type of coconut and tropical oil fats, as well as refined carbs like white rice, sugars, and sodium. And the solution is to eat these same foods and use the same seasonings and flavorings, but to modify them, to use liquid oils instead of solid fats, brown rice instead of white, and then use more chicken, fish, and beans instead of beef and pork. Another barrier is the unhealthy stress eating that we're all obviously prone to during this pandemic. Stress causes overeating, and COVID has stressed everyone out. So the solution is to not bring those foods in the house and buy and snack on healthy foods only. You really want to be cutting up fruit instead of reaching for the cookie jar or the cookie bag, and keeping these healthy food alternatives, snack alternatives in your kitchen and even in your workplace. Next slide. And then, when you really can't, just take this information, process it in your brain by just knowledge, based on the knowledge, and you need to be using sort of cognitive behavioral strategies to really help you make these changes and make them and be more successful at behavior change, no matter what the lifestyle is. So the first step is to examine your confidence and to make the diet change or the lifestyle change and what barriers you perceive. And then to set small goals that are defined and very small goals that are achievable, like eliminating all sugary beverages, adding 2 fruits or vegetables a day, lose 1 to 2 pounds a week. These are small little chunks where we know we can achieve these goals, and it sets us on the road versus having these sweeping changes like I'm going to overhaul my diet or I'm going to lose 50 pounds. Those are too daunting for the brain. Self-monitor your progress, get regular feedback from a dietitian, a behaviorist, or a primary care, or even a family, and then prevent and manage relapses. Now, many people are turning to diet apps that incorporate all of these behavior change techniques, goal setting, tracking, peer support, and progress monitoring. And so some of these are very helpful, and for a nominal fee, these can really be helpful for folks. Okay. All right, let's move on and talk in the remaining time about exercise and health. I'm going to talk about the importance of exercise, the state of exercise in the US and the impact of COVID-19, how to get moving, and what recommendations are out there from the experts. These are just a couple slides here. Go ahead next. So the benefits of exercise, I think everybody knows, but it's amazing when I review an article that the benefits of exercise outweigh anything any pill can take or any other lifestyle measure. It improves body weight, all the risk factors, inflammation, blood pressure, cholesterol, blood glucose, and it also improves our mood, which is so important. Our depression and anxiety levels plummet. These are amazing effects that we could not get from anything else. And the data show that people who exercise the most have a roughly 30 to 40% lower risk of death from cardiovascular disease and reduced risk of death from all causes. And all groups benefit. You could be young, old, you could be in your 90s, you could be in your teens, you could be female or male, and you could be thin or you could be obese. You will benefit from exercise. The biggest benefits, the data show, are in those who go from no activity to just doing some kind of exercise. They have the exponential increase in that we see, and the greatest magnitude of benefit going from nothing to something. Next. Now, before COVID, only about 1 in 4 US adults were meeting the guidelines for physical activity, and 1 in 4 engaged in absolutely no dedicated exercise. And there's no doubt that COVID-19 has reduced these numbers and worsened these numbers due to initially the stay-at-home orders, and now fears and concerns about using gyms and YMCAs, and particularly for seniors who used to do a lot of exercise at senior centers. Some people are even fearful of walking outside, which is pretty unfounded now that what we know about COVID. Next slide. So how do we do and start? It's the same sort of process because it's a behavior change. Examine your confidence in and your barriers for safe exercise outside in the setting of COVID, or inside if you happen to be lucky enough to have some exercise equipment in your house. Set easy, achievable goals. Don't go out and say, I'm going to start exercising 1 hour a day, that you'll easily feel that you're not, that you get tired and you'll be back sitting again. But on the other hand, also consider exercise as medicine that you have to do every day or most days a week, but in small amounts initially. Track your progress. Consider using a wearable device like a Fitbit. These have been shown to help people stick to the program. Consider these coaching exercise apps like Couch to 5K, or some of those that some of my patients are talking about. These have actually been shown to now have some benefits. You can also do YouTube videos for every type of exercise and do a lot of internet streaming of exercise from yoga to calisthenics in your basement. And then you want to work up to what the exercise experts say, which is really up to 150 minutes to 300 minutes of moderate exercise a week. If you have to lose weight, it's got to be in the 300 minute range, but we're talking moderate, and it can be split up. You can do multiple times a day. And to really get that calorie balance, you have to be doing at least 7,000 steps a day. Okay. All right, let's finish up with smoking and health. We'll talk about the risks and benefits of quitting, risks of smoking, benefits of quitting, and then what COVID we think has done, and then how to quit. Next. So we now know that really we've known since the 1960s, right, with the first Surgeon General warning, smoking raises the risk of heart attack and stroke and lung disease. We also know that it causes blood clots and increases death. 1 in 2 people who smokes is going to die of a smoking related reason or cause. In the era of COVID, we now know that smokers have roughly 2 to 3 times the risk of death if they contract COVID. Even a few cigarettes a day has been shown to increase the risk of heart attack. So because it causes the platelets to clump together. So really the number of safely smoked cigarettes is zeros. When you stop, it begins to reverse all of these risks within minutes to weeks. The risk of heart attack is reduced by half after 1 year, and lung and airway inflammation rapidly improves in the days after stopping smoking. So we know that unfortunately, smoking or vaping is still very common in the US and probably has been increased since COVID. Before COVID, about 15% of US adults across the board were still smoking. About half of younger people in certain demographic groups are still smoking. And then large proportions of these are also vaping. COVID-19 associated stress, there's some data shows that it has actually increased the number of people using cigarettes and nicotine. And that's some recent data out of Europe. And where they do smoke more, I haven't seen US data, but I wouldn't be surprised if it's the same. Next slide. So again, it's the same behavior change sort of strategy. These are the steps. Examine your motivations to quit. Most people have to be motivated themselves, whether it's to be around for their kids or grandkids, or another reason, you have to be motivated. Examine your confidence or self-efficacy on a scale of 1 to 10. How confident are you that you could quit? And what are the barriers? This has to be done for each and every person. And then decide on the best method, cold turkey or weaning. And the American Heart Association website goes into these. You want to set a quit day and make a pledge on that day that you will not smoke. Obtain support from family, friends, care providers. Medications, particularly nicotine replacement has helped, and there's some other medications that helps. And you may be able to take some virtual classes now. And then these 2 wonderful websites that I want to make sure everybody's aware of: smoke-free. I'm sorry, there's a little typo. It's not smoke-free, it's smokefree.gov. And then the other is becomeanx.org. And these have wonderful, wonderful resources, including free text services that have been shown to be beneficial. Okay, and then last slide is, even if you do everything to try to reduce heart disease risk during COVID and beyond, it's important to recognize that heart disease starts early in life and it really gets a head start on most people. Even if you do reduce the risks now, you could still have an event and really need to be aware of the risks of staying home with an event versus calling 911, which we all know we should do. Don't fear the hospital just because of the pandemic. Everyone in the hospital is there to protect you. I don't know of one person who's gotten COVID from being taken to the cath lab in the setting of a heart attack. Most doctors now and nurses know how to protect themselves and are not coming down with COVID. And we're all in the hospital every day. And so far, so good, have not, and you'll be protected the same way. Last slide. So I want to thank everybody. I'll be happy to answer questions. I want to make sure everybody is aware of the Healthy Living portal on the heart.org website, which has really a fantastic an amount of information and practical guidance. Also, choosemyplate.gov.coronavirus is the USDA's website for healthy eating during coronavirus. Our Lifespan CVI website. We're happy to see folks who have concerns about their heart health or symptoms, and then smokefree.gov and Become an X. Thank you.
Thank you so much, Dr. Asprey. That was a lot of really great information that you went over in a short period of time, and I'm so appreciative of it. I want to remind everyone on the call that we will be taking questions in the chat box throughout these conversations. So I've already noticed one question, but if anyone else has other things that they would like to ask, please put them in the chat box. And at the end of the presentations, we will have a short time for Q&A. So please be sure to do that. Now I will turn it over to our last speaker, who is Rosemary OBrien, who is the Health and Wellness Specialist with Neighborhood Health Plan of Rhode Island. Welcome, Rosemary.
Hi, everybody. So as Victoria said, my name is Rosemary OBrien, and I am a Health and Wellness Specialist at Neighborhood Health Plan of Rhode Island. I'm here today to talk a little bit about preventive health. And a little bit about our member rewards program at Neighborhood. Next slide. So what is preventive health? Preventive health is taking care of yourself and taking care of your health before you get sick. Not just going to the doctor when you're sick, but learning how to do some things that can help you prevent getting sick. Even if you feel fine, you should still see your medical provider for a well checkup at least once a year. It also helps you to build a relationship with that medical provider so that you feel more comfortable each time you have to go and have a conversation. So preventive health includes things like physicals, checkups, immunizations, shots, sometimes blood work, sometimes other kinds of screenings. Next slide. So why don't people get preventive health care? There are a variety of reasons why. Sometimes people don't have health insurance, which if you don't have health insurance, you can contact Neighborhood Health Plan and they will help you figure out how you can apply. Some people don't trust providers or doctors. Sometimes that's a cultural thing. Sometimes that is someone that you know has had something gone wrong, and so you're fearful of going to the doctors. Sometimes people don't want to get bad news. So it's really scary to go to the doctor with a problem and be worried that they're going to find something. The thing is, if they find something, if you have something that's going on, it's still going on even if you don't know about it. But if you know about it, at least you can get it taken care of. Next slide. Neighborhood wants you to take care of your health. That's the bottom line. Help prevent getting sick or getting a serious condition. So again, for more information, our website is listed here. You can also Google it, NHPRI, and you'll get to our website and find out more information about the program. I just want to say thank you so much for your time. Thank you, American Heart Association, Dr. Asprey, the food bank, and that's it. Thank you, and stay safe.
Thank you so much, Rosemary, for that information. It's really helpful for us to hear. That concludes the formal presentation portion of our webinar today. And now we want to hear from you. Please type any questions you have into the chat box. We really would love to hear if you have any questions for our speakers. I also want to invite all the panelists to come back on camera for our Q&A portion. Welcome, everyone. All right, thank you all for joining us. So much good information was shared today. Really a lot to think about too. I was hoping, Melissa, you could give us a sense of what you are seeing at the food bank, who's coming in. I know there's a greater influx. Given what Dr. Asprey talked to us about healthy dieting, especially during this time, how is the food bank accommodating that and the influx of new people? You're on mute, Melissa. We still can't hear you. Let's see. So odd. No, that's very weird. Okay. Do you want to log out and log back in, and then we can go back to that question? All right, so I will turn it over to Dr. Asprey with one of the questions that we got from an audience member. Her grandmother had open heart surgery last year, and she said that she's worried about COVID-19 and wants to know some ways she can keep her safe. You know, I think we've talked about a few things in terms of lifestyle changes, but what about things like going to the supermarket? How do you exercise during COVID-19? What are things that we should be thinking about for our loved ones who have had a cardiovascular incident?
That's a good question. I don't know the age of your grandmother, but I'm assuming she's over age 65. Just with the practical things, you know, I was at a supermarket this weekend and it was packed and I really almost left. So I would say if someone can do her shopping and buy her the healthy items and have her not go to the store right now while the surge is happening, I think that would be a benefit. You know, so I would say stay out of crowded places and particularly supermarkets. Don't go out dining, outside dining. And really eat healthy, you know, the fruits, the vegetables. I think a lot of people, when they have open heart bypass surgery, they sort of think that their heart arteries are fixed and they're okay to do the things they want in terms of diet, but that is not the case. We really want to make sure that she's eating super healthy. Exercise is key. I tell people, you know, if you live in an apartment or condo, just walk around the walkways in front of your, or if you live in a house, just walk in your driveway. You don't have to go on extensive walks, but do get out and do the walking most days a week to accumulate 30 minutes most days a week. And then don't forget about medications. It's really important to stay on all the cardioprotective medications that folks are on after open heart surgery and then get the cholesterol level checked and make sure the cholesterol level is staying down. A blood pressure cuff at home, if there's a diagnosis of hypertension, is also a benefit. So those are the main things. It's really lifestyle and medications.
Wonderful, thank you for that. And you know, you mentioned the Don't Die of Doubt campaign and ensuring that people are going to the doctor's offices and hospitals. I would assume it's the same for picking up prescriptions. Like I know I get my prescriptions from CVS and I can call ahead. I can do the drive up window, but that's still safe for people to be doing, correct?
Yes, and they can even get deliveries too. Yes, most places will deliver the meds or mail them out, so they don't have to go stand in the line at the drugstore either. So I would say as little of the outside sort of venues as possible. But on the other hand, there's some really good data that social isolation is not a minor thing in terms of our health. And there was a study showing that even just a few phone calls a week made a difference between how people felt and it translated into even some downstream effects in terms of blood markers. So making sure that your older, relatives and friends are getting contacted. And nowadays we have ways, FaceTime and phones to really keep them connected.
Great. And I did want to ask you about gyms. That's something I've had a lot of people ask me about. Is it safe to go to the gym? You've mentioned walking outside, but how about exercising at gyms?
I would say for older folks who have underlying heart disease, probably I'm recommending to my patients that they don't go back to the gyms yet. For younger people who don't have any underlying health conditions, you really just have to just check your gym out. Some of my younger, healthier patients really have said that their gyms are almost empty and they feel comfortable going in and working out there. But if you're older and your gym is crowded and you have or underlying health conditions, I would just walk outside. You don't really need to go to a gym to maintain cardiovascular health.
Great, thank you for that. So Melissa, it looks like you got back on.
Yes, can you hear me okay?
Yes, we can hear you. I was wondering if, you could tell us a little bit more about what's going on at the food bank, and given the information that Dr. Asprey has provided, how is the food bank trying to ensure that people are eating healthy?
Yeah, so I think we're, like Dr. Asprey said, our numbers are up. We have been up since the pandemic started about 45% in distribution. So that's a big, big jump, as you can see. So the food bank is really busy, but we have a lot of things in place to make sure we have healthy food on pantry shelves that we can have for our community. So a big piece of that is, as I mentioned, the Healthy Habits nutrition program that we have here at the food bank, where we have online resources. We're moving our classes online. So our nutrition classes are going to be able to be virtual as starting January. And then we've been posting our nutritional messaging and our healthy recipes on our website as well. So we have that. And then in collaboration with FEMA and other organizations, we also have family boxes and Meals for Kid boxes through a couple of other foundations. So we also have those healthy box products. So we have there's snacks and shelf-stable meals. So things like canned veggies and milk and healthy granola bars, things like that they've been distributing out. And then we also have the Kids Cafe program, which our community kitchen cooks nutritious meals for kids at the YMCA and Boys and Girls Club. Those are our partners. So they're getting nutritious dinner at those locations as well. And summer and fall, we always have an increase in local fresh fruits and vegetables as well. So a lot of great healthy foods are able to reach our community through all those programs and resources. So it's a lot out there. And if anybody wants to, they can check out our website, therhodeislandfoodbank.org. And it talks all about, you can check out video town halls and the healthy habits and seeing what we're doing, and check out the numbers and ways to give, and seeing what our agency members are also doing as well. So a lot of great work out there from them.
Great, thank you so much. And do you feel like, as Dr. Asprey said, one of the healthiest ways to eat is to cook at home? Are people able to still cook at home? I know we have some members of our communities that maybe don't have an oven or have a hot pan and things like that. Is that incorporated into what the food bank is teaching and talking about?
Yeah, absolutely. So with all of our recipes and classes, we try to make it, we utilize ingredients that are found at our food pantries, how to make it nutritious, how to stretch it on their budget. And a lot of our recipes, we just use a skillet. So you just plug it in, a table skillet is all you really need, or a stovetop, or even a microwave. So that's a lot of what our recipes entail. You don't really need anything fancy. No, you don't even need an oven sometimes. So a lot of our recipes are pretty easy, under 15 minutes, 10 ingredients or less, and usually like $5 to $7 for a family of 4. We try to keep our serving sizes too. So yeah, so all of our recipes are definitely accessible to everybody shopping at food pantries.
Wow, that's really amazing. I think what stuck out for me with Dr. Asprey, what you said was that diet is the #1 killer of Americans. And we can do the education, which is so important, but we also want to accommodate people, which it sounds like the food bank is doing really well. I also want to focus a little bit on the smoking and vaping piece. This is something that the Heart Association has really been trying to educate people on even before COVID. But now that we know the links to tobacco usage and COVID, we're really trying to send this message out that this is the time to quit. We know that stress is high, but we want you to know that there are resources out there. Rosemary, I know that you are licensed in smoking cessation. Do you want to talk a little bit about the resources that are out there, both from NHPRI and the state, and your experience with that?
Sure. So Neighborhood has a program for our members called Quit for Life, and I do the tobacco cessation through Quit for Life, and it's a telephone-based program. So no one has to go out of their home to get this service. There also is the 1-800 number, 1-800-QUIT NOW in the state. And if people wanted to know about other resources, because there are a number of certified tobacco treatment specialists in the state, what they can do is go to the Rhode Island Department of Health website and go under tobacco control program, and they'll be able to find out what other programs there are in the state. I know what you're saying. It is really difficult for people to quit, especially in a time of high stress. It is doable. Research shows that if you work with a professional, someone who can help you with the tobacco cessation, and you use behavior change in some kind of tobacco cessation aid, like the nicotine patch or nicotine gum, that you're more likely, at least 2 times more likely, to be able to quit. There's a lot involved with trying to quit, and there's a lot of things that people can learn, tips and tricks to help them through that process.
Yeah, so
Oh, yes, go ahead.
no, I was going to say it's very, very important, and it's tough because of the stress. I think there's some data that people are finding it more difficult, but yet again, on the other hand, it's so important to really be looking at ways to quit it, because there's some good data. I think during prior infections, virus pandemics or epidemics, I should say, in the US, we found that smokers also had much higher rates of death. And I think this is now evident from COVID. So it's really, really important to try to give our lungs every chance of fighting this virus if we contract it.
I agree.
Great, thank you. And if people are interested in hearing a bit more about tobacco use and the connection with COVID, also the rise in vaping usage among students and youths, which is a huge issue that we're facing not only in Rhode Island, but across the country. The American Heart Association and Neighborhood Health Plan of Rhode Island did another community conversation a couple of weeks ago, which you can find on our American Heart Association Southern New England YouTube page, and that is completely focused on smoking cessation, vaping, youth, and COVID. So a lot of great information there. We are almost at the top of the hour, so I want to just thank our speakers for taking the time to meet with us today. This has just been so wonderful and such a great resource for so many of us. You are all so dedicated to helping our community, and I am very thankful. We are especially grateful to the Rhode Island Community Food Bank for the great work that they're doing to keep our communities fed and healthy and to do all this nutrition education. This is such an important topic and one that impacts all of us in Rhode Island and across the country. So thank you again to all of our attendees for joining us today. And I hope everyone has a great afternoon. Thank you so much.
Thank you. Stay safe, everyone. Thank you.
Stay safe. Thank you.